Dr. Bongiovani, thank you so much for being with us today.
Thank you.
I'm very excited that we're here to talk about the use of orthotics in the treatment of heel pain. Dr. Bongiovani, I understand you are a foot surgeon as well as a partner with the Weil Foot Ankle Institute, and you see patients both in the Des Plaines office as well as the Libertyville office. So to start out, why don't you explain to us what orthotics are and how they are used to treat heel pain?
Well, what orthotics are, they are orthopedic devices that are worn in a patient's shoe, and they function by correcting the mechanics of the patient's foot. A properly designed orthotic will be used to treat plantar fasciitis by correcting three attributes. The first thing it must do is it must maintain the heel in proper alignment, which ultimately takes pressure off the ligament. Secondarily, it also increases shock absorptive forces through the ligament, which also decreases pain. And third, it decreases vibratory and stress reactions in the ligament, which also is used to alleviate the heel pain that the patient is experiencing. Now, there are different types of orthotics. There are functional and there are accommodative. The orthotic that we've developed at the Weil Institute is a hybrid orthotic where we've taken the best of both worlds. Some doctors either make them really hard into a hard plastic, and some of them will make them soft. And again, we've created this hybrid device where a patient gets the best attributes of both worlds. And that's really what has made us famous and has really kept us at the forefront in treating heel pain via orthotics.
So when you talked about the vibration effect on the ligament, can you explain that in simple terms, what that means?
There was a bioengineer in Canada that did a study on this, and he found out that part of the reason why patients develop pain and inflammation in ligaments and tendons is due to this micro vibratory sensation that occurs in ligaments, and orthotics actually stop the vibration, which ultimately eradicates the pain and inflammation that patients are experiencing.
Okay, so it's the vibration from walking or running.
Correct.
That is going to exacerbate the pain.
Exactly.
Interesting. And so, again, you mentioned this very unique orthotic that you and your partners at Weil Foot Ankle Institute have developed to treat heel pain. And I understand you actually make them here. You're one of the few physicians in the entire state that do that. Can you explain why that's a great benefit to patients?
The reason being is we have quality control of the product we make. It is made on site by our trained technicians that I personally have trained, have been with me for almost a decade. Again, we have a unique quality control that we use in making them. Specifically, we have specific materials that are made for us. We have custom-made vacuum presses. We have custom-made grinding machines, and because of this, we have a very unique way of making them. I really don't know anyone that has our formula, and again, this is a formula we've developed. I and other physicians have developed over the years. I personally have been making orthotics since I was 6 years old with my dad, and after having made thousands of these, you learn all these little tricks of the trade and little niches that really make our devices unique. We put a lot of detail into our design. Even if you look at our materials are made out of, orthotics are made out of 6 different layers of materials, whereas most labs just a couple layers at most, 2 layers at most, whereas ours has a lot more technology built into it.
Perfect. So it's, from what I understand you're saying, it's the fit, but it's also that balance between the hardness of the orthotic as well as the cushioning effect
Correct.
Of the orthotic.
It's pretty much the same philosophy that running shoe companies are using, like ASICs. They like to use these soft polyurethanes that are both soft but yet supportive. And again, our orthotic is based on the same philosophy. You get a soft device, but yet it's supportive enough to give you the stability you need to alleviate the heel pain that a patient is experiencing.
Perfect. And once a patient has an orthotic made and they're wearing it in their shoes, how long before they see some relief?
That's actually the most rewarding thing. I'd say within 1 to 2 weeks, the average patient is 70% better.
That's amazing.
Yeah, for something that's non-invasive, it's a great modality.
I will close by, of course, thanking you for your time today, and also encouraging people who see this video to submit questions they may have about orthotics to an email address, which is info@weilforfeet.com. They can also reply to the blog with any questions that they may have.
Thank you
so much.
Thanks.